Yat'e. It means it is good, as in it's good to see you, it's good to meet you. And the appropriate answer is O, which is yes, it is good to meet you. Good afternoon. I'm Dr. Plunkett. Awus Nizgayish means my shoulder hurts. Alatsin Nizgai, my wrist hurts.
What about your throat? Big ah?
I may be the only fun thing in their whole day is when the silly doctor tried his Navajo on me. I'm Earl K. Plunkett. I really love people. That's why I went into medicine. You know, all medical students pre-med trying to get into medical school say that they want to help people, and I really did. I began practicing as a family physician in 1976 and chose to practice in little bitty towns in southern Utah or Nevada that couldn't attract a physician, or at least couldn't attract their family. Montezuma Creek Clinic is located on the Navajo Reservation. It's as rural as you would care to be for most people, but I came to help people. That's what I like to do best, and the economic situation in this area provides lots of people that need help, and I'm one of the few that chooses to live in a very rural environment. I wanted to work for CompHealth for several reasons. I certainly had lots of offers to settle down and work a permanent position. I wanted to travel within the U.S. CompHealth, of course, pays for my malpractice insurance. I'm shielded almost entirely from the paperwork, the tedium of getting licensed. Between CompHealth and their excellent team and my wife, I can focus literally on what I trained to do, which is to practice medicine.
Show me where.
Well, I've fairly carefully defined the kind of assignment that I most enjoy, in terms of the size of the community, family practice, not to include OB in the clinic rather than being a hospitalist. And they have very much gone out and found for me acceptable assignments that meet a whole list of criteria that literally define exactly what I like to do the most. And they've been magic in terms of finding those assignments.
Howdy.
Now's my turn to relax a little bit, to be off at night, not on every other night or every night 24/7. I've built several medical practices from the ground up. I've worked my way up the corporate ladder. I've been the head of a hospital and 3 clinics. Been there and done that, and I don't need to go there and do that anymore. I like the freedom of being able to travel to see different parts of the country, to more define what kind of practice I want to do, and locum tenens solves all of that all in one fell swoop. With CompHealth, I've never had an assignment that I didn't like the people. I've never had to feel that I had to compromise the quality of medicine that I was practicing. I wasn't put in a position where the dollar was the absolute ultimate thing. I don't know how CompHealth sifts through and finds people that are nice and people that value people, but so far that's been my experience. Is that when I say thank you? I'm anxious to let them know I care, anxious to project that I value them as a human being. They are the people, and this is their nation, and it's their home. To some people's eyes, it's a forsaken desert. I think beauty's in the eye of the beholder.